Hi, I'm Dr. Dan Lensink. You probably have questions about eyelid surgery. In this video, I'll answer the questions most commonly asked of me by my patients during a personal consultation. We'll do it from the setting of an examining room, as though you were sitting in front of me in the examining room chair. As you may have already discovered from other areas of this website, I'm a board-certified ophthalmologist. I went on to do fellowship training in plastic surgery of the eyes. This means I do surgery of the eyelids, the tear ducts, and the eye socket, which we call the orbit. I perform both cosmetic and reconstructive surgery around the eyes. Because I'm an ophthalmologist and have fellowship training in ophthalmic plastic surgery, this affords me the unique ability to care for the area around the eyes from the point of view of an eye doctor who's primarily concerned about the health of the eyes themselves. First, we'll spend some time getting to know one another. Then we'll move on to discuss your concern, which for the purposes of this video we'll assume to be eyelid surgery. Once your exam is completed, we'll discuss insurance carrier issues such as whether additional testing or prior authorization might be required. We will also help you understand your out-of-pocket expenses and so on. Next, we will discuss the surgical procedure in detail. I like to use drawings and photographs to make sure you understand and are comfortable with the procedure itself. You're probably concerned about sutures. 80% of the time, I'm able to use very fine self-dissolving sutures, which means that you'll barely be able to see them and they'll go away on their own. From your perspective, sutures should hardly be an issue at all. If you live in Northern California, then your surgery will be performed at the Redding Surgery Center on Sonoma Street, just a few blocks from my primary office. If you live on the California coast, your surgery would be performed at the Humboldt Physician Surgery and Laser Center affiliated with North Coast Ophthalmology in Eureka. If you live in Southern Oregon, your surgery will be performed at the Ashland Surgery Center affiliated with Siskiyou Eye Center in Ashland. These facilities are all licensed surgery centers. They're all Medicare approved. Each is very clean, very modern, and quite comfortable. An anesthesia specialist will be present first and foremost to monitor your vital signs and to make sure you're safe, but also to sedate you as you desire. Most patients prefer to be heavily sedated, but occasionally we have someone who desires very little sedation. The point here is, as I tell my teenagers, you have choices. Depending on the surgical procedure you choose, you can expect the surgery to take somewhere between 45 minutes and an hour and a half, but we don't expect you to be aware of the passage of this time because of the sedating medication. Once your surgery is complete, we'll take you to the recovery area and, while this sounds unprofessional, we will place bags of frozen peas as cold compresses on your eyes. We've been through every cold compress known to humankind. Frozen peas are by far the best. Then after about a half hour, you'll be able to go home. Because of the sedating medication, however, you'll need a driver to get you home, but you can expect to be able to drive the following morning. Once you arrive home, we'll ask you to use cold compresses frequently for the remainder of that day and, to a lesser extent, the day after. So while you won't be laid up after surgery, there will be a 2-day period of taking it easy and staying close to home. By the end of the 3rd day, you can get on with your life. However, there are 2 caveats to that. First, we'll ask you to avoid activity that causes bleeding for about 10 days. That means keeping your head above your heart when bending over to tie your shoes, avoiding lifting things that make you grunt and groan and get a red face, and so on. The second caveat is that you'll have to plan your work and social life around black eyes. You should expect your eyes to be quite swollen and bruised after surgery, growing worse for the first day or 2. 90% of the time, within 2 weeks, the bruising and swelling is resolved to the point where you can go to the grocery store without wearing sunglasses or getting stares. While you can expect to be able to go out in public after surgery without getting stares in about 2 weeks' time, I wouldn't plan a portrait photo for a few months. Your surgical wounds will mature and improve for months after surgery. So to summarize the healing course, 1 day of no driving, 2 days of taking it easy with cold compresses, 10 to 14 days of avoiding strenuous activity and dealing with bruised eyes, in a few months to achieve ideal healing. Please don't fall asleep, we have 2 more topics left to discuss. The eyelids have a very good blood supply, so it is really important to avoid blood thinning medications. If you are taking prescription or doctor-recommended blood thinners, we are not in the business of stopping medications they have started. But we will ask you to ask your doctor for permission to stop prescription or recommended blood thinners before surgery. There are a number of over-the-counter blood thinners we would also ask you to avoid. We'll have a 2-week before surgery list and a 3-day before surgery list. It's a good idea to bring with you a list of all medications and homeopathic remedies you take. We are obligated to talk to you about the risks of surgery. Our laundry list of potential complications, you'll note, is nothing more than a long-winded way of saying anything is possible. The list includes bleeding, infection, scarring, double vision, dry eye, abnormal eyelid position, numbness around the eyes, and the last 3, which I've thankfully never seen, are loss of vision, heart attack, and stroke. While this list may sound scary, significant and/or permanent complications happen very, very rarely. So that's the end of our overview on eyelid surgery. From here, we would discuss any concerns and answer any questions you might have. Once you've decided to move forward, I would then bring in other members of my staff to complete other testing or move into the surgery scheduling process. We hope we get the chance to meet you face to face.